Hey y'all, let's talk about 5 reasons why vaginal delivery is best for pregnant women. I'm Dr. Fatu Forna. I am an OBGYN who works to keep pregnant women safe here in the US and around the world. So most babies, about 70% of babies in the US are born vaginally. But we also have a significant number of babies who are born by cesarean section. But overall, we all know that vaginal delivery is the best type of delivery in most situations. So I wanted to talk about 5 reasons why that is. Number one, vaginal delivery is the most natural way to deliver a baby. That's how it was supposed to be. Since human beings evolved, babies come out through the vagina. We started doing cesarean sections much later in evolution to save lives. Cesarean section is a life-saving procedure. Do not get it twisted. Yes, we understand that because there's sometimes we need to do it to save the lives of mother and baby. But we still know and we still try our best for vaginal deliveries because that's best for mom and baby. So number two, reasons why vaginal delivery is best is because it's safer for mom. In most cases, vaginal delivery is safer than a cesarean section because it just has less complications. It's not a surgery. Cesarean section is a surgery, has surgical complications, bleeding, infections, damage to the surrounding organs, blood clots, lots of complications. But the reason I say is in some cases is because there are cases where you don't want mom can't push. Her pelvis is crushed. She has a heart condition. She has a medical condition where she's, pushing might make it worse. So in most cases, vaginal delivery is safest for mom. There are a few cases where a cesarean section is safer, and we can talk about that. Number three, vaginal delivery is thought to be safer for baby. When the baby's coming out through the birth canal, there are muscles that kind of squeeze the baby and squeeze a lot of the fluid because, when the baby is in the womb, the baby's breathing in amniotic fluid in and out. So these muscles squeeze the fluid out of the baby's lungs. So babies that are born vaginally are less likely to have breathing problems because all that fluid goes out. There's also some thought that being exposed to the good bacteria in the mom's vagina coming out, it enters the baby's system and it helps with that. So safer for baby. Number four, this is huge. Vaginal delivery is better because of quicker recovery for mom. You can have, yes, it's difficult to push out a baby and to be in labor. Yes, it is. But typically, once that baby is out, you snap back like that. I mean, you feel like yourself within a few hours. You're able to get up, use the bathroom. By the next day, you're up and around doing stuff, and recovery is much quicker. A lot of times, within just a week or two, you're close to coming back. Just close to coming back to normal. Whereas with a cesarean section, it's a major surgery. Your belly is open and then closed. It's a lot of pain. You're in the hospital longer. Vaginal delivery, you're there just 1 or 2 days. C-section, you might be there like 4 days or so. You need someone to help you at home. It's painful to take care of the baby. Bonding with the baby, breastfeeding is just it's harder. So vaginal delivery is much easier and a quicker recovery. Number 5, and very, very important, is there's less maternal death, less risk of dying if you have a vaginal delivery. Women who have a cesarean section are 3 times more likely to die, and that's because of the risks of surgery, blood clots, and not only risk with this pregnancy, with future pregnancies, there are risk, so many complications. So because of that, we don't want you to have a cesarean section unless it's absolutely necessary. So given all this, most doctors and midwives, they really do try their best, at least in the US, try our best to ensure a vaginal delivery. Now, we sometimes have to do a C-section because the baby's not tolerating labor, the baby gets stuck, labor stops progressing, or mom is ill and we need to deliver quickly or else she's gonna die. So cesarean sections are life-saving procedures. So Black women, don't be too upset if you're in labor and a C-section is needed because 30% of all deliveries in the US are C-sections. But don't be too upset because we got to do what we got to do to keep the baby safe. Because at the end of the day, We want you and the baby to survive and thrive. And that's why we think vaginal delivery is overall best, and that's what we promote. Thanks.